Hello, my name is Simone and I'm a registered nurse. I made this video today to demonstrate and teach more about hand expression. In general, when we think about expressing human milk, the first thing that often comes to mind, or on an infant registry, is manual or electric breast pumps. But despite advancements in milk removal technology, a mother's own hands are effective and offer several advantages over breast pumps. Some of the benefits, they cost her nothing. Pumps can range from $40 to $500 at the least. Hand expression may trigger a more effective milk ejection reflex, especially when we add in relaxation and massage. Hands are always available, and their hands are effective at compressing the breast for milk removal, which protects the lactating parent's supply, provides milk for the baby, and also protects against painful engorgement. Hand expression is available interpartum, and so getting everyone comfortable with their bodies and expressing milk beforehand, they can go to the hospital with milk already expressed and be ready to go for whatever happens, because we all know that birth can sometimes be a wild ride for a mother or baby. And so it's nice to enter the hospital prepared and feeling ready and confident in your ability to express your milk. It does carry some risk interpartum. It's important to talk with the healthcare provider if there are risks for premature labor. You need adequate privacy. You're quite exposed in order to manual express. So it's all about mother's comfort or chest feeding comfort. It can be time consuming. It's at least 23 minutes, 20 to 30 minutes, like per side. Although for short, frequent expressions are recommended, you can still only do one side at a time, right? Which takes away from your time to complete other things. Another thing to think about as the hospital and the community centers are often colonized with Staph aureus, which can be a cause of bacteria strain and mastitis, or if they have a damaged nipple. So hand hygiene is so important. The great thing is that S. aureus is killed with most ethanol-based hand sanitizers, but not MRSA. So it's important to keep in mind what their health history is. And so let's get to just a little bit of information. Manual expression techniques, they vary across cultures. It's really interesting to kind of read about different cultures and how it's practiced. But essentially, when it comes down to it, it's the same. Breasts are most effective when compressed well behind the nipple. Thanks to high levels of oxytocin the first hour post-birth, colostrum expression is very easy. In the first 48 hours, manual expression can often be more comfortable and easier than pumping. Hand expression can be useful to express right onto a spoon to help calm a fussy baby so that they can have time to play and to just develop that deep latch. Interpartum colostrum collection can aid in increasing milk stores postpartum and allows a parent a little bit of security should there be latching difficulties, health concerns for mother or infant, and also if mother, she's healthy postpartum, but she's just tired or not feeling that well, a partner or a nurse can also help hand express and protect that supply. Okay, so let's get to a little bit of technique. So I have this knitted breast here. So wash your hands. Wake up your breast, or just, gentle massages. Lean back, get comfortable. You can play a little bit of music. Warm compresses are helpful and massage, but it's time consuming. So don't depend on it. But press forward back with your chest, 3 centimeters over the nipple, and then compress the thumb and the 2 front fingers towards each other. So it's compress and relax and compress and relax and release pressure. Relax the hand and just let comfort be your guide. If you're interpartum, you're going to want an oral syringe. The 1cc syringes work the best because you're only going to get a few drops, and it feels really good when you fill the whole syringe. So you're going to compress and just collect the small drops. Postpartum, you're going to get a lot more. You're going to want one of these, or sometimes even a whole bowl. And so you're going to use gravity and lean forward and compress and relax and compress and relax until the breasts are soft and empty, and you can give them a massage to make sure you get all those good fats out while you're expressing as well. Yeah. So, should all women learn to hand express? Definitely. Hands are always available. It's one of the most important things that you can do to is empty breasts, more milk, especially if moms have a short capacity. You can express like 30 to 50 milliliters an hour, which is just perfect, especially if you're having an infant with latch difficulties or low birth weight. It's just a really great tool that mothers can learn and feel confident in. Thanks. Bye.